Okay, can you name one risk factor for suicide? I already mentioned few. Just blurt it out or say it. One area of risk factor for suicide. What can put a teen into suicide risk? Anything.
Divorce of his or her parents.
So family dynamics at home. Divorce, definitely.
Breakup with the girlfriend.
Breakup, so separation, recent separation or recent breakup with a girlfriend, that's a big one. You see that a lot. Drug abuse, yes, very much so.
Moving to a new school.
You're right, changing of the environment and adjustment to that environment.
Cyberbullying.
But
Cyber.
bullying, yes, of course, bullying and feeling weak and unable, self-esteem and all these things. So all that is absolutely right. I just justified it and I put it in a individual and dynamic and fixed. So previous suicide attempt for us is a very high measure. If you have an attempt in the past, you are much more prone to attempt again. There is almost like a barrier that was broken and a trial and kind of like testing the water. How's it gonna feel? And how people around me are gonna feel and all that. And most of the time they say like it was just attention seeking. I just broke up and all this. I just wanted her attention or whatever. But that puts you in way up on the graph, kind of like for high. Lethality of means. Kind of like if you're having a pen or a pencil that you're scratching yourself, different from access to guns and actually having a gun and all that. And then just, so the way, or hanging yourself or a rope or something of that nature. So the lethality of means is definitely, if you get a kid like that, don't ignore it. We have seen a lot of, unfortunately, the dynamics of things like that are major, and sometimes you get pushed by insurance companies to release a kid after he tried to hang himself and saying he's not suicidal, and then they go home and after like a month or so, he actually succeeded in that. So there is a lot of mix and complicated dynamics in that. The psychopathology is basically what we talked about. If you have major depression diagnosed, that's a high suicide risk. That's one of the highest. Bipolar, same thing. Substance, definitely, it's kind of like remove that part. Most, even in adults, most of the times we see that people who cannot really attempt, they have to get a drink or get to do something to be able to complete the suicide. Unfortunately, that is not to be taken lightly after like assessment or after that was unsuccessful 48 hours. Say, oh, I was just intoxicated or I was just drunk. No, most of the time actually people use that as a way to kind of like lower down their cortical judgment and say that and make it easier. So all these factors, the pathology of substance, depression, conduct, personality disorder, impulsive, if you're more impulsive, which impulsive characteristic could be even including ADHD. So if you have depression and ADHD and more impulsive to do things, what does it mean? I mean, like just pulling the trigger and you have a lethal mean in front of you. There is no questioning about that. So this is the individual factors. We also have some demographics factors. So what we talked about. Male, white is more, and above the age of 14. Really, as we've seen in the graphs, kind of like once you hit like 15 or something, the suicide rates are much higher, depression is much higher than 11 or 12. You gotta keep an eye on everybody, but this is demographic risk. Unwanted pregnancy, that's if she got pregnant, and it's kind of like everybody's saying, this, and you gotta get rid and all that, unwanted, and being even without that. I mean, like there's a lot of mixed feelings about that in teens. They are not prepared mentally and emotionally to take care of that, and then all of a sudden she's pregnant. I mean, like the easiest way out is just get rid of everybody. I cannot get rid of part of me, so I'm just, and this is again in women's psychology and all that. There is family environmental risk factor, which all of you have named. It's kind of like if you have a firearm at home, that's a much higher risk. Now, about that, and I know Texas and everything, it's kind of like almost every house may have that, but at least make sure you like the safe place and the bullets and two different, and all of them are, most of the kids, what we have seen is most of the kids know where the gun is. Most of the kids know where, if the bullets are there or not. Most of the kids know the code. most of the kids. And you're like, really? So just, we gotta be more attentive to these matters. The family pathology discord, we talked about all that, separation, recent divorce, recent moving to a new school or a new state, abuse, of course, sexual, physical abuse, history of violence, and then recent stressors, anything, separation, legal problems, arrest, all these things. It's just a lot of dynamics, and adults sometimes cannot even cope with that. So, I mean, like, can you imagine 15 or 16 years old to really cope and put things into perspective? It's just beyond their capacity. I put a few slides here about out of character. Again, this is like the clues for you to keep an eye, and we discussed most of that. If you see some of that, just be vocal about it, and we'll talk about in a second how you can handle that if you've seen out of character. I'm not telling you to be paranoid about every single thing, but just keep open-minded about that. Abrupt changes in attendance. So if they've been going to school or going to sports or something, and then all of a sudden drop, keep an eye on that. Failure to complete assignments, grades, as we talked about, lack of interest, sudden change in appearance, all of a sudden he woke up and he's like absolutely different person. You can hardly know, can be like dyeing hair and nail polish and all these things. So you gotta question what's going on with their network and all that. Final arrangement, this is not very common, but we've seen it, like they start to kind of like spread their properties, or kind of like Xbox, you can take that, or you can take this, or you can do this, or so spreading their, making arrangements. Increased irritability, preoccupation with death, as we talked about, abrupt changes in eating and sleeping habits. That's not typical, but we sometimes see it as well. Like all of a sudden, their sleep pattern has changed, their eating pattern is much less. We've seen much more poor appetite than increased appetite, so keep an eye on all these things. And we're talking about, obviously, not just one day thing. We're talking about going forward for like at least 2 weeks or more. That's the criteria. This is what we talked about as well. So irresponsible behavior, rebellious behavior, you see that, and we talked about impulsivity and how that can comorbid with depression as well. Alcohol and drugs, never did this, and all of a sudden they started to. We've seen a lot of now with cannabis, of course, that's very common, and a lot of kids may have that since the age of 13, and hardly, I mean, like a very high percentage when you interview, they say like, I started when I was 13 and it was there already or something. Now with the e-cigarettes and all that, this is the second epidemic, unfortunately, for adolescents and all that. And now some of the companies actually put THC or cannabinoid oil into these e-cigarettes or vape. So just keep an eye on all these things. Now, why this is important? Because the brain has not developed. You're talking about somebody whose brain, neurons and synapses and the pruning process and all that has not really fully developed totally. And then you add another chemicals from outside that you already know that affects. Actually, a lot of the studies show it lowers the IQ, and it just stay like that. So you have an A student start to chronically doing weed for like good amount of time. His IQ is going to be at least 10 points less. And that's in a very confirmed study. Shocking. And you are just moving yourself from being very successful professional to a different level for the rest of your life. So.
Can you say prolonged period of time? What does that mean?
Well, at least I'm not talking about trying or experimenting once or twice. We're talking about like chronically, and honestly, I think there's no quite clear time frame, but I would say at least more than a few months. So it's kind of like if this has been a pattern and he's like doing this for like a few months to now we are talking about years, and this is the only thing, and he's justifying, and medicine doesn't deal with that. I have all that anxiety and it helps. It helps me sleep. It helps me, and some families may actually buy into it. And some parents would say, okay, well, you're giving him medicine for sleep. This is working for him. What's wrong with that? So then you have to see.